Regarding the trauma part that we spoke about earlier, how different is working with children compared to adults, and how do you handle that difference?
Okay, so the most common problem with children, like pediatrics, is that they will have developmental delays. Okay, maybe when they are born, something wasn't developed properly. So their progression, like from crawling to like walking, they will be delayed. And some children, they will also have like difficulties to understand you. They won't be able to tell you what they want. They won't even understand what you're saying. So as a physical therapy in the pediatrics sector, so if a patient, if a child can understand you, it's good. But if they cannot understand you, that's where you have to use another skill of yours to really get the child to do what they have to do. So we incorporate a lot of play therapy. So I've worked with some kids, which is like having not only developmental delays, but they also have like mental issues. So they don't really understand what you're talking about. But our goal as a physio is to get them to at least be able to walk independently by themselves. Do things independently, eat independently, or sit independently. So knowing the child's goal, that's why you work. With adults, definitely if the adults can talk, it's much easier because you know what is their problem. And because like I'm talking to you, you can understand me, so it's easy. No matter who we are working with, we need to come into a mutual understanding. What is the goal, realistic goal that we can achieve? That's how we work with children and adults.
Because of course you work with people who've been through these kind of traumas and strokes, or children with developmental issues. Does seeing and working with these kinds of things take a toll on you, emotionally or mentally?
So when I was a student, because when you're a student, right, when you're a physio student, when you go to placements, okay, so I'm talking to like any physio students who are watching this. So when you go working in different fields and areas, you will start to think, where do you want to work? And if there is any specific field that you want to work, or where is the place that you don't want to work in. So for me personally, after I graduated, I didn't apply to work in a hospital. I worked in a private setting that focuses on sports and muscle and joints.
Right.
So because of my experiences in the hospital with children, I feel like that's not something that I would enjoy. And one of the reasons why I find it really challenging for me to work in a hospital is because of the environment. So back to the question, working in a hospital makes me feel it's challenging, You go to a hospital and you see people that is really asking you for help. But of course, you don't get to pick who you want to see. When patients come in, when clients contact you, and you're able to help them, definitely I would go and take up the case to help them.
I see. Okay. So in the physiotherapy clinic, I'm quite curious actually, are patients assigned to you? You can say, oh, I want, I'll choose this one, or I'll take this one.
So mostly, whoever who comes into the clinic or make an appointment, if the person has any preferred therapist, they would go for the preferred therapist. Right. If they don't have any preferred therapist, we will just assign to whoever that is available.
Right. And since we were speaking on experience earlier, because you've had some experience working in Australia, and the lifestyles are very different from Malaysian lifestyles to the Australian lifestyles. It's more of a Western lifestyle, right? So in that regard, is there a difference between the frequency of certain injuries? Does it make a difference, the lifestyles?
Okay, so when I went to Australia, it was actually for a clinical placement. Okay, something like an internship. So that clinic was focused on neuro patients, which are patients like strokes, brain injury, Parkinson's disease. But when I went there and when I came back, I really see the difference in lifestyle. Like the 76-year-old patient that I see in Australia who has got a stroke, he will come to the clinic, do his rehab, and say that I want to go back hiking.
Wow.
And continue, this lifestyle, going hiking and running,
Mm-hmm.
and of course there are the active populations, but there are also the populations that maybe I've gotten a stroke, I can't do this anymore, I just need to rest. That's where a good physiotherapist will come in and try to enlighten them, like, hey, this is a stroke, your brain is able to rewire, you're able to rehab, you can go back doing what you like. So the differences are definitely in terms of the lifestyle there. But of course, there are some populations in the clients that I see in Australia that is also sedentary lah.
Right.
But I was really surprised at the older people and the activity level compared to the patients that I see here when I'm in hospital. Definitely it's different.
Right. And in working in both countries, do you have a most memorable injury that you have helped with in your career?
Yes. One of the most rewarding experience is that I've got this client who came in with back pain for like 7 years. So she's been having back pain for 7 years, even before I studied physio.
Mm-hmm.
And in the 7 years, she has been visiting hospital every year. Because every year there will be one attack of a back pain that causes her excruciating pain that she needs to be hospitalized.
Right.
And then she will go for her rehab. It's always in and out. Until I met her, and she was this person who is really like terrified of moving. It's so bad that it's not just physically, it's emotionally and mentally, like you're already traumatized, that you're going to get back pain each year. And because her lifestyle is desk job. Okay,
right,
so very common problem is slip disc. Have you heard of slip disc?
Yeah, I have.
Yeah. So so when she came in, she was like so afraid and just, people tell me I'm going to die. Doctors say I have to do surgery, and she's only like less than 30 years old, okay?
Oh, so young.
And then I see her, then I was like, okay. So I started telling her that, okay, look, this is not true. Doesn't mean if you have back pain, doesn't mean that you must go for surgery. And after you go for surgery, doesn't mean that you can't go on with life, But of course, it doesn't take one session for me to just tell her and she will, oh yeah, oh okay.
Right.
No lah. It will take a lot of sessions to really go in. Of course, you want to tell them, tackle them mentally, but you also have to physically try to ease them to a certain movement. So that was really, really memorable. Now that patient and client, she is like doing her normal life,
Right.
And because it's been 7 years, and because she's seen so many physios, for me to make a difference to her, right, it's really like, I feel so happy. I feel so inspired to really keep on helping people and educating them, So that is one of the things that really made me very happy to be a physio.
Wow, that's really amazing.
So in Australia, what was really interesting to me is this child, okay, who has this condition, okay? So she couldn't understand me. She can't really walk herself as well.
Mm-hmm.
So the physio there just told me that, okay, you go ahead and do and treat her, So it was really life-changing to be with and meet people like that, because this child, technically she's just in her own world, and I'm there trying to hi, look at this. So sometimes it can get really frustrating, but what I've learned from the experience is that you just have to know what the child likes and try to get their attention and try to get them to do the movement that they want to do. So when I was there for about 8 weeks, so I saw this child from the beginning until the end.
Mm-hmm.
From the beginning, I remember it was really, really challenging. And up to the end, the child is able to, be independently, walk and stand.
Oh, wow.
She was sitting on this wheelchair, and the wheelchair is the ones that you can adjust. And that time the goal was to get her to at least stand by herself. So I'm really glad that in these 8 weeks that I was there, we are able to see this change.
That's
so
amazing.
Despite the child not understanding you, and you're able to achieve that with her, it's actually a very rewarding and an experience I will never forget. Fulfilling job that I love very much.
Of course. Do you have any tips on specific habits that we should adopt or stay away from, from your standpoint?
So a very simple thing that everyone literally can do, especially during this pandemic, because all of us were on computers, we're on laptops the whole day for like 9 a.m. to 5 p.m. or even longer, So the one tip or one advice I would give to everyone is that you have to get up and you need to move. You cannot just sit there for a long time, because what I see and what I've learned throughout this whole journey of being a physio, when I see a patient in hospital, the thought that comes to my mind is that, man, this condition that he's having could have been avoided if this person just picked up a little active lifestyle, move a little bit better in their daily life, that can really make a big difference. And I want to say that you only have one body, so you have to take care of that body, because you're not gonna be getting another body, So simple things like sitting on a chair, standing up, turning your body, moving your head, is a big love to the joints in your whole body. So that piece of advice is to move.
Of course, I'm gonna go in for a jog after this.
Yeah, definitely.
Wow, thank you so much for the advice. Thank you for being here. We learned so much in this one interview alone. It's really, really amazing. And to all our viewers, to all our watchers, remember, move around. That is always the way. Prevention is always better than the cure, right?
Definitely, that's right.
Right. And if you liked today's episode, remember to like and subscribe for more. If you have suggestions for professionals to talk to in the future, let us know in the comments. Check out our website where we post articles and podcasts weekly. You can check out our Instagram as well, at @theyouth_official_ for updates on our content. See you next time around. Thank you, Celine.
Okay, thank you.
Bye-bye.
Bye.